greetings from our Department of Pediatrics. I am Dr. Vijay Kulkarni, Professor and Head, Department of Pediatrics, SDM Medical College. Today, amidst the lockdown of coronavirus, that is COVID-19, all of you are really concerned how to manage COVID-19 in pediatric age group. So I would like to share some thoughts about the pattern of the disease affecting the children and what essentially a pediatrician should know about COVID-19. As you all know, friends, coronavirus is an RNA virus. It's basically an enveloped RNA virus. The etiological agent of the following disease, but different strains of coronavirus have been nomenclatured by the WHO. It is called by WHO as novel coronavirus COVID-19. That is novel COVID-19. It is also the same virus but a different strain which can also cause severe acute respiratory syndrome, that is SARS, or it can also cause Middle East respiratory syndrome. So what would be the pattern of the disease, how it will affect a child? The common symptoms, we are very lucky and thankful to the God that the percentage of child affected by COVID-19 virus is around 2.4% and much lesser than that. Till now, the child has been protected by COVID-19 virus. The common presentations or whatever the experience we have got now from the city of Wuhan, and few case reports what we have seen till now among the pediatric age population, the common symptoms noticeable were fever, then the children can have productive cough, and very few cases where a child had breathlessness, then they have myalgia like symptoms, the child can have sore throat, and he could as well have a poor appetite. Some uncommon symptoms were also noticeable in a pediatric age group, being the diarrhea, vomiting, headache, and one child had hemoptysis and also chest pain. As you all are aware of the incubation period of the virus, it ranges from 2 to 14 days, the median being 5 days, but the shedding of the viral load among the stool feces is as high as 37 to 40 days. The mode of transmission, it could be a droplet infection, it could be a direct contact, it could be a close contact. Close contact, my friends, is not just you pass by a person, it is not told as a close contact. The definition of a close contact is a person who is in contact with a person who is supposed to be having COVID-19 for at least a minimum of 10 minutes, or who is not following the 2-meter distance or the 6 feet distance. Okay, and it can also spread by hands, contaminated hands. So when we should suspect COVID-19, especially we suspect COVID-19 in a child who has history of contact with a person, with an adult patient who is having history of travel. Either this travel history could be a national travel, or it could be an interstate travel or an international travel, or it could be a travel to high risk countries in the last 14 days and exposure to COVID-19. It could be of any age group. How do you take the samples? What is the diagnostic modality? RT-PCR is the recommended test. Then how we do this RT-PCR is basically we do a nasopharyngeal swab, and this swab is taken by an ENT surgeon, or then we take help of the microbiology people. Then this is transported at 2 to 4 degrees Celsius in a viral media. In sometimes where in very serious patients who are intubated, who are in the ICU, we can also send the ET aspirates or a bronchoalveolar lavage, and this specimen has to be, we should follow the universal precautions, as this tissue sample could be a COVID, it could be a multiplier of, or it could spread the infection. So we should collect the sample in a sterile container at room temperature and see that it reaches the laboratory as early as possible. So whenever you have a patient, a child comes with contact with positive case, if he has history of a positive case, then this positive case, whether that fellow is symptomatic or asymptomatic, then if he is asymptomatic, then what we recommend is usually home quarantine for 14 days, and they should also take care that these family members also should be home quarantine. And if he's symptomatic, if he has fever, cough or dyspnea, then we should test for COVID-19 or RT-PCR. Then if he doesn't have history of contact with a positive case, then also you should if he is asymptomatic, then no need to worry. If he is symptomatic, then again home quarantine. If he is having severe acute respiratory illness, then probably you need to send him to an institutional setup. There are some guidelines which have come of late which tell how to conduct a delivery, especially with a pregnant lady who is COVID positive. So what are the guidelines by the WHO? The guidelines tells that the delivery shall take place in a dedicated isolation room. The doctors, especially conducting the delivery, should take care of themselves. They should wear personal protective equipment, especially all the personal protective equipment. They should have a face shield. They should cover themselves with 2 layers of gloves. And if this baby, the delivery has to be conducted in an isolation room, and all infant resuscitation, and if the delivery of this mother, if the baby is delivered and has a problem, this baby needs to be resuscitated as per the standard neonatal resuscitation program guidelines. Then the clinical staff or the doctors or the dayas or the nursing staff should take care of the droplet infections, or with the tissue sample of the mother, the universal precautions should be taken. N95 masks, eye protection goggles are needed. Then bag and mask ventilation, intubation, suctioning oxygen, especially all the equipment which are related to neonatal resuscitation program should be sterilized again and again and should be used. Once the baby has delivered, then the baby, if the mother has history of COVID-19 travel or history of contact with a COVID-19 patient, or the mother herself is COVID-19 positive, this baby has to be immediately after the delivery should be bathed by lukewarm water with a gentle soap after birth before we transfer this baby to NICU for observation for at least minimum of 2 to 3 days. Then a caution on cord clamping. There is delayed cord clamping is not recommended. The mother, once we admit the baby in the NICU, then comes the role of breastfeeding. The mother should be assisted to initiate breast milk feeding or expression soon after the delivery if the condition allows. The only caveat that the breastfeeding should be started or initiated after proper hand hygiene. The mother should wear personal protective equipment. As far as possible, she should wear at least minimum of a mask or a glove, wearing face mask, and she can as well clean the breast. Then she can clean the breast and clean her hands with soap and water, then hold the baby, then she can breastfeed the baby. Now, what about the diagnostic test to be conducted on the baby? You should always have a high index of suspicion, especially when you are dealing with a COVID-19 delivery and the baby is in the NICU. Both stable and unstable infants should be moved immediately after resuscitation room. You should have a dedicated isolation room in the NICU. Then babies which are suspected or confirmed mothers who are delivered from confirmed mothers with COVID-19 should have a throat swab or a nasopharyngeal swab, and this should be done at 12 hours of life or at 24 hours of life, and this again should be repeated after 2 or 3 days. then they should be reported to the laboratory. Are there any other specific markers which could pinpoint towards the COVID-19 in a pediatric age group? The other markers, what is being noticed in Chinese children, which has been affected by some population, by pediatric population, these children were found to have leukopenia. In some children, CRP, the C-reactive protein, was elevated. Procalcitonin, which was normal unless associated with secondary bacterial infection. In some children, the LDH was elevated almost in 3/4 of the patients, and CPK was also elevated in 1/3 of the patients. The chest X-ray or the CT findings, this goes hand in hand with adult findings. We find infiltrates, we find consolidation, we find the mottling, we have a ground glass appearance. By and large, pleural effusion is rare in children, and it is not one finding that is very classical of X-ray finding, which is very classical of COVID-19. All of them are non-specific findings for COVID-19. So then how do we treat these children? The standard guidelines at present, what has been recommended till now today, as of maybe I am recording this on today is May 8th. As of now, there are a lot of trials being conducted. We at present we give, as per the WHO, oseltamivir. If the child happens to be less than 12 months of age, we give 6 mg per kg. If he is more than 12 months, then if he is less than 15 kgs, we give 60 mg per day. The maximum you can give is a 90 mg per day dose. Okay, so you can give BD dose for 5 days. The oseltamivir can be given. The other antivirals which have been of some use, but still many studies need to be conducted, where there are no documented evidence where these antivirals have a role in breaking the replication of the virus. Other antiviral drugs which have been used are lopinavir and ritonavir. The doses of lopinavir being 200 or 100 mg BD. Then if the child is less than 15 kgs, we can give a dose of 12 mg per kg per dose. If the child is more than 40 mg, for more than 40 kgs, you can give 400 or 100 mg tablet. You can give BD for 5 to 14 days. Yes, there's been lot of hustle and bustle about chloroquine, that is hydroxychloroquine. Again, the studies are very, very limited. We don't have a concrete evidence to tell that hydroxychloroquine has a definite role. Somehow we have an edge in saying that in malaria endemic zone, probably coronavirus may not be so virulent. I don't know about that. But the dose of hydroxychloroquine can be 8 mg per kg loading dose. Then we give 4 mg per kg BD for 5 days. In adults, we give 400 mg BD on day 1 and then 400 mg weekly till the pandemic is over. The other drugs, ganciclovir, another which has fascinated lot of interest is remdesivir, which has been a lot of trials on this drug has been on in US. Almost 90 trials on remdesivir has been going on. They tell some trials have shown positive result as far as the outcome is concerned. This I am talking of a adult population, and I don't have any evidence at present to tell that remdesivir is useful in case of a pediatric population. Is the role of IVIG recommended? Not recommended at present. There is no role for hospitalized patients, especially with pneumonia and ARDS. Yes, chloroquine, again, as I told you, it shows in vitro activity against SARS-CoV-2. At present, no data to support the role of chloroquine in COVID-19. And what are the indications of N95 mask? N95 mask, especially for healthcare workers who are handling COVID-19 patients, especially when you are in a typical ICU setting, when you are handling intubation, when you are doing suctioning, when you are doing bronchoalveolar lavage, or when you are handling nebulization or non-invasive ventilation or CPAP, or you are doing a cardiopulmonary resuscitation, definitely yes, health worker should take care of himself by wearing a personal protective equipment, by wearing a N95 mask. What about nebulization? Yes, it's a very frequent question the pediatrician should be knowing. Yes, if positive cases are reported in your locality, the recommendation would be to avoid nebulization as it increases the risk of spread of droplets, to longer distances. The best media would be to give a meter dose inhaler. It is as effective as a nebulizer. Yes, oxygen, how to deliver? Yes, oxygen prongs is a better option when compared to simple face mask. Then what is the risk of a patient or a child in quarantine, or if the spacing between the two beds in quarantine is less than 6 feet, then it poses a higher risk of transfer of the aerosols. Coming to my last slide, how do I go about this COVID-19 pandemic? One most important thing is the hand hygiene, frequent hand washing with soap. Then this is the time-tested evidence which definitely will cut down the infection rates. Social distancing, and they tell 70% alcohol hand rub solution is the best disinfectant. Surgical mask or those in contact with positive cases, yes, then avoid touching the face and adjusting the mask. Then maintain at least a 6 feet distance from the positive cases. Lot of trials are being conducted. At least 6 vaccine trials are going on at present. And we are very lucky. I would like to share that Serum Institute in our country is conducting a vaccine trial along with collaboration with Oxford University. The vaccine being named as a Shadox vaccine. Almost first phase of human trial is over. Hopefully by the end of this year, probably we will have the vaccine on COVID-19. Hopefully it will act. So what would be my last take-home message in this course of amidst this pandemic? First thing is stay home, have social distancing, at least 6 feet distance. Avoid places like where you anticipate crowds to be there. Avoid such as mass gatherings or a puja place, going to a temple, mosque or a church. Then going to malls, try avoiding that. Don't travel unnecessarily. Travel only if it is necessarily. Wear a mask. See, it is lot of personal responsibility of each and every citizen of this country, rather than the government's responsibility. We should act as responsible citizen. Then only we can break this chain of this COVID-19. Thank you so much. Stay safe, wear a mask, avoid handshaking, and practice social distancing. Thank you.